Hi, welcome to Navigating Health with Pacific Islander Communities, a learning course with the Asian and Pacific Islander American Health Forum. My name is Alisi Tulua, and we'll be going on to Module 5. I hope that you've had the opportunity to watch the previous modules, because this module that I'll be covering today builds on knowledge from the previous four. The most recent one that I covered talked about where Native Hawaiians and Pacific Islanders live in the United States and some of the health, social determinants of health that contribute to the lives of the community currently. Today, I will be talking about the state of health in Native Hawaiian and Pacific Islander communities currently. And the objectives that I hope to achieve is I hope to increase knowledge about the current state of Native Hawaiian and Pacific Islander health, and also increase understanding about key factors in moving Native Hawaiians and Pacific Islanders closer to health equity. So let's get started. In the previous module, I talked about how so much of the social determinants of health, coupled with the lack of awareness in the community due to lack of investment and just the lack of access to factors that contribute to good health in communities, how all of those things work together and contribute to poor health outcomes in the Native Hawaiian and Pacific Islander community. If there was ever a moment where the existing disparities in the communities made itself clear, it is during this pandemic that we're currently living through. And you can see this very clearly with Native Hawaiian and Pacific Islander communities. You can see it clearly actually with all communities of color, immigrant communities. The disparities that existed before in health were further amplified by what the impact that COVID had on those populations. But today I'm going to highlight what happened in the Native Hawaiian and Pacific Islander communities with regards to COVID. Early on in the pandemic, at the ground level in the community, we started to see and hear about the spread of COVID-19 in the community, and it wasn't too farther later, or it wasn't too much later, that we started to hear of the data to quantify what we were hearing on the ground. And so we have been able to track data. This data is from the Native Hawaiian Pacific Islander COVID-19 data dashboard that's put together by the NHPI Data Policy Lab, which is housed at UCLA Center for Health Policy Research. They were able to track data since last April to show the case rate per 100,000 and the death rate per 100,000 in the population for the states in the country that disaggregated NHPI. Currently, there are 21 states that are reporting the data in that manner, and that dashboard captures the case and the death rates per 100,000. And what we were able to see, and although I'm talking to you with the latest data, which is as of July 14, 2021, we were able to see early on how much higher the case rates and the death rates were for our community, because relative to our smaller size, what was happening in the community was devastating. And this is something that you can see really clearly with this graph of what was happening in Arkansas, which is one of our communities that was hit the hardest. We have our largest Marshallese population in the country is in Arkansas, and that was the population that was impacted the most. And so as you can see here, the orange line depicts the Native Hawaiian and Pacific Islander communities. And so you can see here for the population in Hawaii, the population in California, and the population here in Arkansas, that the case rates for all of those states are highest for Native Hawaiian and Pacific Islander populations. So as of July 14th, the total Native Hawaiian and Pacific Islander cases are 57,574 cases and a total of 875 deaths. That's a lot that the community as small as ours had to deal with. And so when you compared to other race and ethnic groups, the Native Hawaiian and Pacific Islander communities in the majority of states that reported our data disaggregated had the highest case rate per 100,000 and the highest death rate per 100,000. So we saw the same trend in most of the states that disaggregated our data. So as I said earlier, what happened with COVID highlighted the disparities that existed in the community before. And so I'm going to go into some of the data that I was able to capture that shows some of the health outcomes in the community. And I'm just going to preface that it's hard to find data for our community because data gathering is still really poor for our population. A lot of the data is still aggregated with Asian American under API. And so I was able to get some data that is disaggregated for our community, and that's what I'll be sharing today. So consider what we're seeing with COVID-19, one of the outcomes, right? So it's kind of the convergence of many things that existed before. And so I'll be touching on some of those. The first piece of data that I'm sharing here is from the Community of Contrast Demographics Report that was published by EPIC and Asian Americans Advancing Justice Los Angeles in 2014. And this is this pie chart shows the causes of death among NHPI between 2005 and 2010. And as you can see here, Native Hawaiian Pacific Islanders are disproportionately impacted by some of these chronic diseases, including heart disease, cancer, and diabetes. But in these years, the number one cause of death in the community is heart disease. And then second to that is, cancer, and then diabetes. So you can see this really high rate of chronic disease in the community. This data is from 2014, so a little bit more recent data. And this data is taken from the Native Hawaiian and Pacific Islander National Health Interview Survey. And this comes from the CDC. And, this is a little bit of data on chronic disease that is taken. These are the percentages of adults aged 18 and over with looking at cancer, coronary heart disease, and diabetes. As you can see here with diabetes, 15.6% of adult Pacific Islanders have diabetes, which is a rate here that is compared to the total population and compared to single race Asian population is much higher. And, some of the information here is that Pacific Islanders are 2.5 times more likely to be diagnosed with diabetes and also 2.5 times more likely to die from diabetes. The other piece of information here is, as you remember from the previous slide, heart disease is the number one cause of death in the community. And as you can see here, 6% of adult Pacific Islanders have coronary heart disease, and when compared to other populations is higher. The other disease here we're looking at is cancer, and 5.7% of adult Pacific Islanders in 2014 have had cancer, which is lower than the total US population, but higher than single race Asians. A couple of pieces of information which is related to all three of these chronic diseases is the rates of obesity and overweight population in the community. And as you can see here, 76.1%. So this is higher than 3/4 of adult Pacific Islanders are either overweight or obese. And the other piece of data, which is also sad to look at, is nearly half of Pacific Islander high school students are either overweight or obese. And so you can see how there just might seem like there's a pipeline into chronic disease in the community, because if you consider nearly half of high school students are already on their way to having these chronic conditions, it's disheartening to see that piece of data. The NHPI National Health Interview Survey also measured what Pacific Islanders thought of their overall quality of health or health quality, and 15.5% of Pacific Islanders who participated in this survey, Pacific Islander adults, felt like their health was either fair or poor. And that's compared to 12% of the US population and even lower of single race Asians. This graph also is displaying another piece of information which we don't always see when we're looking for data in Pacific Islander health, and that is something related to mental health. So it's interesting to touch on this, is that 4.1% of adult Pacific Islanders in 2014 experienced a serious psychological distress in the past 30 days of having taken this survey, which is a rate that is higher than the US total population and single race Asians. And so in looking at some of the data, I was able to pull in some other information that I think I wanted to highlight, because these are areas where it's not always easy to find data, but I wanted to bring it into this presentation. And this is from the Office of Minority Health. They had 2019 data, which is probably the most recent data that I've seen in our community. And so this is Native Hawaiian and Pacific Islanders were 2.4 times more likely to be diagnosed with HIV infection as compared to white population. We don't often talk about HIV in our population, in our community. There are other health conditions that always take priority. And so HIV isn't a health issue that is often gets any attention. And so to look at this piece of data, I'm prompted to think a little bit more about what we need to do as a community around HIV. The other piece of data here is Native Hawaiian and Pacific Islander mothers were 4.6 times more likely to receive late or no prenatal care as compared to non-Hispanic white mothers. This is a really high proportion, and almost indicative of even when you think about infant mortality rate for our community, the health of birthing mothers. And so it's really alarming to take a look at this. And also, as I said before, something that is prompting me to think a little bit about some of these areas of work that often don't receive any resources or support for our community around prenatal care for our birthing mothers. Last but not least, this is an issue tied to mental health. And like I said, there isn't always data is really limited in a lot of these areas, particularly mental health, which is a huge issue in our community. And this is suicide was the leading cause of death for Native Hawaiians and Pacific Islanders ages 15 to 24. This is 2019 data. And I can't imagine the impact that the pandemic had, particularly in this age group of our population, since this is data from before that. And so there's quite a bit of work that we have to think about around the health of our community moving forward, especially because of the pandemic. So that's all of the data that I was able to pull together for today's presentation. But having presented some of that, I think we can understand that with the previous modules, providing context and getting to this point where I'm sharing with you some of the health outcomes in the community, I'm sure that you would have predicted, or you came in knowing, that health outcomes are really poor in our population. But something that I want to share with this slide is there is constant movement in the community to move towards health equity. And some of the considerations that, as community leaders, nonprofit organizations, are constantly working with, incorporated to all of the work, are these three really important pieces. And I just want to highlight it here. As I shared, data is hard to come by for our community because a lot of our data is aggregated under the AAPI data category. And so we don't get to see the true picture of health in our community when the data is aggregated. And so data disaggregation is really important to helping to move our community towards health equity. And one more piece of data that I want to share here, this is COVID-19 mortality rate for the entire year of 2020 here in California. And we're really lucky to see a little bit more granularity in the data here, because not only that the data is disaggregated from Asian data, it is also disaggregated within the ethnic subgroups that fall under NHPI. And so you can see here, when we're looking at the mortality rate for the entire state, it is at 84 deaths per 100,000. When you look at the data when Asian and NHPI are grouped, the mortality rate falls a little bit. But when you disaggregate NHPI out away from Asian, you can see the significant increase. It's at 123 deaths per 100,000. What's even more alarming is when you disaggregate even further within the category into NHPI subgroups, where you can see here that the Samoan community was highly impacted in 2020 by COVID-19. And then second to that is a Tongan community. And compared to the state total, even the Chamorro and Guamanian community also had rates that were higher than the state total. And so this is why it's important to disaggregate our data. It tells a fuller story about what the community is going through. And so that's one thing. Data disaggregation is important. Secondly, our community, and there are many efforts that are going on in the community, which is going to be the next module. But there are community workers, community leaders that have been in community for decades, that have been gathering and collaborating and partnering to help move our community towards health equity. And the Pacific Islander community that's on the ground helping to support our families know best how to build work that is effective for our community. What is necessary, though, is investment to help to support some of those approaches because these are approaches that are more familiar to our populations, that are usually culturally and linguistically appropriate and relevant, and oftentimes are more effective. So investment in the community and the effort in the community is necessary. And then last but not least, a Pacific Islander healthcare workforce is crucial to helping to continue to move the progress towards health equity forward. Okay, that brings us to our knowledge check for this module. What was the cause of death in the NHPI community between 2006 and 2010? I believe this should be 2005. Is it cancer? Is it diabetes? COVID-19, or heart disease? Okay, the answer is heart disease. That's from that pie chart. Second, number 2, which of these was not a source of health data for this presentation, for this module? Number 1, the California Health Interview Survey. B, a Community of Contrast report. C, Office of Minority Health. And D, NHPI National Health Interview Survey. Which was not a source of health data? Ready? A, California Health Interview Survey. There was no data from this survey that was included in this presentation. Okay, last but not least, which strategy or strategies will help move Native Hawaiians and Pacific Islanders closer to health equity? A, data disaggregation. B, funding for community-based approaches. C, more NHPIs in healthcare workforce. Or D, all of the above. Okay, D. I hope you were able to remember that as the last points of this module. All of these key things are really important in helping to move our community towards health equity. And with that, I would like to say thank you for joining me for this module. I realize it's probably much shorter than the others, which is good because the others were getting longer and longer. And so I would like to close us out today with a quote from one of our activist leaders from the Maori community. And I pulled this quote because it's a reminder about the work that we're doing now isn't just to provide solutions and answers to what we're facing now. It is also a way for us to lay a foundation and a legacy for the generations to come so that they can continue to shape a community that is better than the previous one. So this is from Dame Wina Cooper. She says, "Take care of our children. Take care of what they hear. Take care of what they see. Take care of what they feel. For how the children grow, so will the shape of Aotearoa." So with that, I hope that we as a community collectively will help to think about the ways that we take care of our children and the future of our community so that they can then help to shape a thriving and healthy Native Hawaiian and Pacific Islander community. Thank you and see you next time.